Good evening, everyone. And as I said, thank you very much, Dr. Ajanan sir, for giving me this opportunity to connect with all of you eminent speaker and eminent practitioners in the field of sexual medicine. Today's topic, which is given to me to talk on, is effects of 5-phosphodiesterase inhibitor in psychiatric patients. Uh, I think we all know very well about the 5-phosphodiesterase inhibitor, and previous many speakers talked about the 5-phosphodiesterase inhibitors, their mechanisms, their adverse reactions, and everything. But sometimes we get confused with the word or with the word psychiatric patients. So as this group is a multidisciplinary and having many people from different specialities, like andrologist, urologist, sexual medicine practitioner, gynecologist, and many more. Being a psychiatrist, I take this opportunity to just refresh psychiatric basic knowledge of my all friends and all colleagues from the different specialities. So uh, when being a sexual medicine practitioner, when we take a detailed history, uh, a detailed history is a medical history as well as a sexual and a psychosocial history. Uh, we find sometimes we find that person is having sexual dysfunction as well as a emotional problem. So if we miss that emotional disturbances, or if we miss that comorbidity with sexual dysfunction, there are chances that the trial of 5-phosphodiesterase inhibitor given to that patient cannot be successful. So we should have a proper treatment plan, or I can say that we should have a proper algorithm whenever a person who is presenting with a sexual dysfunction as well as a emotional disturbances. Uh, I do not have a more slides here. I have just kept only 4 to 5 slides. So whenever a person first time presenting to you with the sexual disturbances, and on detailed history, if you find that patient is also having a significant emotional disturbances, then we need to divide that patient into two things. Means, like, is it a first time emotional disturbances, means the patient is presenting first time, or the patient is a known case of psychiatric illness. If the patient is first time presenting you with emotional and sexual disturbances, then we need to classify it properly, that which exactly the primary symptoms are. Means primary symptoms, or primarily the person is going through erectile dysfunction or sexual dysfunction, that's why he's having a secondary anxiety, secondary depression, or secondary some adjustment issues, or the person is suffering from anxiety, primarily depression, OCD, or any other mental illnesses, and secondary is the erectile dysfunction or sexual dysfunction. This differentiation is very important, because if a person is having a ED first and then develops anxiety, definitely the 5-phosphodiesterase inhibitor and counseling and the sex education, proper scientific sex educations, few counseling sessions, they are absolutely fine with that. But if the patient is having a primarily some depression or anxiety, it has to be addressed properly. Unless and until we address that depression, anxiety, or OCD symptoms properly, his ED is not going to you can say, is not going to um, cure with a 5-phosphodiesterase inhibitor, or not going to respond to 5-phosphodiesterase inhibitor. So this is very important thing we all as a sexual medicine practitioner or clinician should take care of it. So this is first classification, where first time the patient is presenting with emotional as well as sexual disturbances. When you find that during history the patient is a known case of a psychiatric illness, and is now the patient is presenting to you with the sexual dysfunction, then again we need to work well on history, and we need to rule out whether this sexual dysfunctioning is due to the course of illness. Is it due to the psychotropic medications like antidepressant, antipsychotic, or mood stabilizer? It's very important. Is it a course of illness? Because a many depression patient is having a anhedonia, lethargy, emotional blunting, and even many schizophrenic patients or psychotic patients, they are also having as a anhedonia or lethargy as a course of illness or a part of a psychopathology, as well as the patients who is on antidepressant or anxiolytic or antipsychotic or mood stabilizer, they can have a secondary sexual dysfunction. So again, this classification or this differentiation has to made when we are treating a patient in the clinic. So what are the then exactly the strategies to deal with the sexual side effect of the psychotropic medications? I think Dr. Prashant and Dr. Shiv is going to talk about the psychotropic medications and the 5-phosphodiesterase inhibitors. So I'm not going to cover and going to talk about more about that. But the strategies for the treatment plan, how should be the treatment plan? If the patient is a known case of psychiatric illness and is having a sexual dysfunction, then there are few strategies we can opt for with the help of a treating psychiatrist. That first is we can reduce the medicines to the effective doses. When sometimes what happens when there is an exacerbation of the symptoms are there, the patient has treated with the higher doses. But once the patient's symptoms get settled down and they are responding well to the medicine, we can reduce the doses to the maximum effective doses, minimal effective doses. So that can be one strategy. Second, if even minimal effective doses, the patient is having a side effect, means as antidepressant, mainly due to the psychotropic medication induced side effects are due to either serotonin or dopamine and prolactin dysregulation. Means if the patient is on antipsychotic, then there is a hyperprolactinemia, and antidepressant and anxiolytic, they are usually deal with the serotonin dysregulations. So when in spite of reducing the medicine, if the patient is having a sexual dysfunction, then we can think about switching to the another group. There are now many antidepressants in the market as well as antipsychotic, which are having a minimal side effects, or few antidepressants or anxiolytic is not having a sexual side effect also. I think about which Dr. Prashant and Dr. Shiv will talk. So this is about the switching or changing the doses. Third thing is patience, wait and watch, because many times with few antidepressant, initially the patient complains about the sexual side effect, but slowly later the sexual side effects wane off. So we just need to wait and watch. And third, definitely at last, if the patient on antidepressant or antipsychotic, well maintained on the medicines, his symptoms are well, definitely adding 5-phosphodiesterase inhibitor is definitely helpful for the patient. So this is how this is something I just brushed off all of your basic knowledge of the psychiatry. So thank you very much. Thank you very much for your patience listening.